Hello, everybody. It's my honor to present today's CQI, If a Picture Paints a Thousand Words, Illustration in Drain Labeling. We have noted that there was increased clinical incidence related to misidentification of drain in terms of wrong laterality and wrong side removal or shifting by interns and nurses. And there was non-standardized drain labeling with eligible handwriting. How to enhance communication with better identification? We need to have a system change in standardizing drain identification with clear illustration in terms of wordings and pictures. We start to gather stakeholders of various departments to discuss on their current methods of drain labeling for gap analysis. We then procured commercially printed drain labels with Chinese and English wordings with pictograms, which are designed for users' feedback with hands-on trial. Here's our drain labels. We have two kinds of drain labels. One is sticking on drainage bag and collection bottle with pictures, and another with wordings which are sticked on catheter, connection tube, and tubings. And there are 12 designs of drain labels, including PCN and free text drain labels, PTC, PTBDs, pleural drains, hip drains, pelvic drains, and abdominal drains. And here's illustrated how our picture paints a thousand words. Because we have drain labeling on the drainage bag and drainage bottles, and staff, like nurses or supporting staff, when they empty the drains, they could look at the sites and then chart the drainage volume and color precisely. And also, there are wordings in Chinese, so the supporting staff found it very user-friendly. While in terms of drain shifting and removal, interns and nurses could identify the drains starting from the tubings to the drainage bags, so they could identify the drain precisely and to prevent from the wrong laterality or wrong site removal. We need to ensure the marking of the drain label could be easily seen, and if the patient is discharged outside our hospital or to other hospitals, we need to remove the drain labels. While when the patients are transferred to our rehabilitation hospitals in Liking Block, we keep the drain labels. And when the drainage types are not available, we encourage staff to use blank labels with legible handwritings. In terms of abiding by the current department practice in labeling the drains. We have this pilot implementation in Operation Theatre and Interventional Suites, which was commenced in Princess Margaret Hospital in April 2024. It was further rolled out in May 2024 in CMC. The evaluation was conducted after half-year rollout in October 2024. And the evaluation results, we conducted an evaluation using online questionnaire by delivering the questionnaire to 3 doctors from each specialty with 7 nurses. Totally, we have 120 respondents. And we found that the color coding of the drain labels was clear and easy to understand. Over 70% of them agree with this sentence, while they found it helps to quickly identify the drain type and have improved communication and handover during patient care activity. It also reduced the risk of drain misidentification, and the overall quality and durability of the outsourced color-coded labels are satisfactory. The overall benefits of the pilot drain label was promising. It helps to prevent misidentification and mixing-ups, which contributes to enhancing patient safety. It enhanced communication and handover, especially for supporting staff and nurses. It also have easy identification of drain types inside, aiding quick decision-making and patient care. It was eye-catching and with standardized, consistent label formats with improved recognition and readability for our staff. It facilitates word rounds and with overall promising user experience. On the other hand, there are challenges and limitations of color-coded drain labels. The labels may be too large for small drains, which require cutting, and some labels for drains, like tubo drains, can only be used once per shift, and the visibility issues, it may not be easily visible in some lighting conditions, like dim condition, and most importantly, we need to ensure the initial labeling of drains are precise and correct during the interventional suite or in operation theater. In order to achieve this, we reinforce the labeling of drains by operators or surgeons, which they should be the most guarantee person who know the site of the drain, and then followed by another counter-checking by nurses afterwards. So for way forward, after implementation of these improvement measures, we noted that there was no incident related to wrong drain removal or shifting was noted. And in view of the promising results, we tend to roll this out to other hospitals in our cluster, and all other hospitals are guaranteed for further rollout. Thank you very much for your time, and we look forward for your questions and sharing. Thank you very much.